Now I'm going to log in with my personal developed CineMR login. If the student is working with MedSkills, they will be provided a login from the faculty member. We'll click Login. The system software, all users will see this white arrow circulating. This is cross-population of updating of information for the patient, for medications that have been added to the formulary, and for provider orders that may have entered into the patient profile recently. When the system completely propagates, I now have tabulations on the left-hand side of the screen, as we've noted from previous MedsManager lessons. In this instance, at the cabinet, most commonly the student will drop down to the Dispense tab for removal of a medication to relocate it either to a medication cart or to take it to the patient bedside directly. Either are appropriate based on the faculty desire. Now, if I click the Dispense tab here to attempt to retrieve my medication, all I see is a cabinet image, and I don't have reference as to what medication is located in which drawer or door compartment. So the recommendation, if the students are doing a dispensation, is to look at the Inventory tab first. The inventory is a listing of all the medications in the specific medication device, be it the medication cabinet or the cart. We're working at the cabinet. And the student can scroll through the list to locate the medication. They can utilize the filters in the center of the page, seeking out the drug name, the classification that they may be interested in, or a scheduled medication if they're interested in that. These filters relate to what is stocked in the cabinet, and that's a really important point. The student also can simply type in the search tool for a medication that they're trying to locate, then click the Apply button. And as long as the medication is stocked in the cabinet, it identifies readily in the software that we do have demo dose low pressor in our contents. So the student can then determine this medication is stocked in drawer 3, pocket 11. So now I can go to my Dispense tab. On my image file, I'll locate drawer 3. The electronics of my drawer just released. Pocket 11 is identified here, and on my table, I'll see pocket 11. Click on the blue pocket where my medication was identified to be stocked, and I have a listing of medications that may be in that location. Some pocket users, based on the faculty desire, can set up multiple medications in a pocket. That's not a common application, but it can be done. So the student will see there may be 2 different medications here in this list. What I'm going to focus on is this green dispense button. If I click on that, it's going to give me the opportunity to retrieve my low pressor, because in this instance, that's the medication that I'm seeking. I'm going to retrieve my barcode scanner for accuracy and scan the medication. And when I do so, the low pressor naming convention matches up to what I just scanned, because that's in my software. So I'm accurate in my selection of my drug. The update of quantity, if this medication sample is actually being taken to the bedside and used, torn apart, discarded, the student would want to update this quantity to what is remaining in the drawer. That helps with inventory management and restocking for other simulated events. So in my instance, I want to remove 1 medication. There are currently 8 pills in the bin. I'm going to change that to 7. And my software will memorize that and assist in inventory management in that regard. I can click the Dispense tab and move on with my next activity. If this medication retrieval incorporated a waste, maybe of this low pressor 50 milligram that's supplied in my sample, I only need 25 milligrams of that dose, I can waste 25 milligrams of the medication. But anytime there's a waste involved, there's going to be a prompt on the screen that's requesting a witness log into the system to validate what the user is wasting. So it takes the students through a more realistic process about a waste of a medication. If the student is not wasting, no problem, we can continue on with the dispense application. And one big reminder is the student does need to be guided to return the drawer to its locked position for medication security to complete their task. If they have another medication they're interested in, they'll click the drawer first. Medication, select the pocket, and dispense the med. We've talked in previous MedsManager lessons about the tabulations on the left-hand side that are visible to the student. Notice the recall and messaging items that are blinking here. There's a visual cues that there is information that the student may want to review as part of their medication event. The student has the ability to choose when and if they investigate these two items. Recalls are always messages that are associated to medication recalls or important information the student may need for medication safety, such as a black box warning or a supply chain shortage that they need to be aware of. In order to visualize the content of whatever is the concern, the student will click on the tab. They'll see information in the recall heading. In this instance, this normal saline has been visualized previously, but this acetaminophen tablet has verbiage that says new right in front of it. Anytime the red indicator is blinking, that's a visual cue to the user that there's new information to be added. So in this case, as the Tylenol here has not been activated previously, I'm going to click on that, and there will be visual verbiage that have been included on the screen for the student investigation. They may not have to do anything with what they see, but they can move on to their activity after visualization. In the messaging tab, similar activity. This is more of an addition for realism of any notifications that the faculty or the users want to share between each other. Oftentimes it's educator to student. So it could be that this faculty wants to engage the students with open lab hours or a welcome notification. Similarly, the student will see that indicator blinking red as we saw it. These are two new messages for the students that they have not, this student in particular hasn't visualized previously. So if I click on the indicator, it'll give the student the available text that the faculty has communication devised for, and he or she can move on with their activity. And then the student will simply, at the completion of their activity, go up to the name drop-down in the upper right-hand corner and click log out to assure security.